I do want to say welcome. We're really happy to have everybody here. My name's Teresa Minen. I'm the Director of Clinical Education for the Respiratory Therapy program. So there's been a real big call to action amongst the groups to try to figure out ways to incorporate more interprofessional collaboration in schools so that we start learning the different parts and pieces of it. So I just want to go through some of the crisis resource management and the 5 key points. So think about how your resources are. So River Falls today is going to play a critical access hospital. So they don't have the same resources that our facility does here, and we're playing more of a level 1 trauma center here in Eau Claire. So in River Falls, their resources are going to be much less than the resources we would have at a larger facility. Brainstorm a little bit how telepresence will help with that. So in a critical access hospital like that, being able to call someone that you don't have access to would be a big deal. So the way that they're going to be able to use that and utilize their resources today is they're going to be able to use the telepresence to gain the resources of the people that they don't have access to in that hospital. So one of the things I want you guys to be aware of today when we're going through is remember and maybe kind of designate in those situations who the leader's going to be and how that's going to follow through with today. Everybody plays an important role in every team. Regardless of whether you're the leader or your other parts of the team, you want to make sure that you're following and making sure that you're living up to those roles. It's really important that the workload starts to be divided up a little bit to make sure that everything's getting done in a timely fashion and getting done well. If everybody divides things up and they go along, there's less mistakes that occur because then they're focusing on that one task that they have to do. So we want to make sure that that's happening as well. And then finally, mobilizing available resources for optimum management. River Falls is quite aware of the fact that we are going to be their hospital. We're going to be resources for them and vice versa. So we want to make sure that we're mobilizing those resources not only within the room, but that we're remembering that we have resources available on telepresence as well. So the patient will start in the critical access hospital with River Falls taking care of this patient. We will watch them and help them and guide them as they need it and request it of us, but we'll be able to see everything that happens there. Then eventually that patient will be transferred to us, and we will be taking care of that same patient here for the second part of the scenario. So we're hoping that the overarching and the whole goal of this whole thing is to learn from each other and the other disciplines that are participating today. Learn what each of the disciplines has to offer and how you might utilize them when you go out and about into your professional practice, using our good communication across the telepresence and learning from each other today. So we're hoping that that's really what's going to happen in the end. There are a massive amount of learning objectives. A lot of them kind of come back to the same thing. They're coming back to making sure that we are taking really good care of our patient, that we're maintaining patient safety, that we are utilizing our skills that we have all learned to this point to make sure the patient is taken care of well, while also practicing good teamwork and working together and figuring out what each other's roles are. You're supposed to be learning from what's happening there as opposed to being nervous about what you're going to be doing. If you have questions, we really want you to ask and make sure that you step up and do that. So really what we're using today is we are using one of the ARISE scenarios, and really the scenarios run using an iPad. We'll scan some QR codes when they're needed, and really what happens is the iPad kind of becomes like an electronic medical record system as well. You can see the orders, you can see the chart, you can see your labs, there's a MAR in there. So we'll be able to guide you through that. There's a QR code, we can scan it, and it will allow for a better sound or visual representation of what's there.